Today, I want to talk about how COVID-19 is almost certainly going to devastate the lives of many displaced and refugee children around the world. The virus will gain a foothold in refugee camps, crowded reception centers, or detention facilities holding migrant families. Given how quickly it's spreading, such a scenario is looking imminent. I've been to many of these centers and camps in Bangladesh, Mexico, Myanmar, South Sudan, Syria, Yemen, and many other places, and the living conditions can be terrible. Overcrowding is a real problem. Water and soap are not always easily available. Physical distancing is almost impossible. A COVID-19 outbreak in these conditions will be a nightmare. Let's not forget that even without a pandemic, children and families who are living as refugees, migrants, or internally displaced already face immense challenges. They do not have the luxury of calling a doctor when they're sick, or learning online, or even of washing their hands whenever they need to. And we are not talking about a small number of people either. Today there are 31 million children who have been uprooted from their homes, including over 17 million internally displaced, 12.7 million refugees, and 1.1 million asylum seekers. All of them need some form of assistance. That's why any public health response to the pandemic should reach the most vulnerable families, because these families need access to testing and treatment. They need to know how to keep safe and healthy. They need to have hygiene products and water and sanitation services. There's one more point I'd like to make. The containment measures that we're seeing around the world should not block children's right to seek asylum and reunite with family members, and they should not affect humanitarian agencies' efforts to provide aid. We at UNICEF are working with our partners to prevent the spread of disease among refugee, migrant, and displaced populations. We are promoting hygiene practices that help prevent transmission. We're developing information on COVID-19 and materials to fight stigma and promote positive parenting. We're also distributing hygiene supplies and providing access to water. But obviously, we cannot do this alone. Now more than ever, governments and the international community should come together and protect the most vulnerable in these unprecedented times. Thank you, as always, for supporting UNICEF. Remember to check unicef.org/coronavirus for more information or tips on how to keep safe and stay informed. Thank you.